everyone, and welcome to Health Reform Beyond the Basics. Thank you for joining us today. My name is Ina Rubin, and this is a project of the Center on Budget and Policy Priorities. Beyond the Basics is designed to provide training and resources to facilitate enrollment in the health insurance marketplace and Medicaid. We are a nonprofit policy organization and are not a part of the U.S. Department of Health and Human Services. Beyond the Basics is aimed at healthcare assisters, advocates, state and local officials, and others who help people get and keep their health coverage. This webinar is not intended for press purposes. Today's webinar is the fourth in a 9-part series of webinars that will cover a range of enrollment topics. Webinars are held at 2 p.m. Eastern, 11 a.m. Pacific on Tuesdays and Thursdays throughout October. You can register for upcoming webinars and view past webinars at www.healthreformbeyondthebasics.org. After the webinar, we'll circulate the slides, a video recording of this presentation, and additional resources. We'll also post everything on the Beyond the Basics website. All participants are muted and in listen-only mode. If you'd like to ask a question, click on the Q&A icon in the control panel at the bottom of your webinar screen and type your question into the box. We'll be monitoring questions and we'll pause for Q&A during the presentation. We may not be able to answer every question asked, but we will have a record of all of your questions and we'll use them as a guide for future resources and presentations. You can also email your questions during and after the webinar to beyondthebasics@cbpp.org. Today's webinar will cover how to help consumers complete documentation requirements related to enrollment in health coverage programs, including both how to prevent data matching issues from occurring when possible and how to resolve them when they do occur. Today's presenters here at the Center on Budget and Policy Priorities are Tara Straw, Senior Policy Analyst, and Shelby Gonzales, Director of Immigration Policy. And with that, I'll let Shelby take it away.
Thank you, Ina, and good afternoon, everyone. Thank you for joining our webinar today. As Ina mentioned, we're going to focus on sharing what we know about data matching process that the federally facilitated marketplace uses. When I say federally facilitated marketplace, I'm referring to the healthcare.gov system. And our goal is to help you understand the steps that you can take to prevent data matching issues from occurring to the extent that they're within your capacity and ability. Not everything, there are certain things you can't do to prevent data matching issues, but there are certain things you can do. And we hope that to the extent that there's stuff that you can do, that we're gonna highlight those today. And then when they do occur, when you do have a data matching issue that happens with somebody that you are trying to help with the application process, our hope is to give you some information that will help you to resolve those issues. So when people complete the application for health insurance affordability programs, they are instructed to provide truthful information about the, and also they're told about the consequences of not providing truthful information about themselves and their circumstances in the application. Some eligibility factors, for example, state residency, can be determined based off of attestation alone, and other factors such as citizenship and income must be verified. The marketplace is set up to try to verify as many factors as possible through electronic data matching with key trusted sources. This happens through what we refer to as the Federal Data Services Hub. What this looks like to a consumer is that the consumer just provides information about key information like their date of birth, their social security number, all sorts of other, factors like their income. And then healthcare.gov uses that information. And then through this data services hub, it goes out to different trusted data sources to see if those factors match up close enough. Then, when those factors do match up, it's great. Those factors can be verified electronically, and the consumer then does not have to take extra steps to provide documents to prove those factors. So, for example, this data services hub goes out to the OPM database and Medicaid agencies to try to verify whether an applicant is enrolled in other coverage. Another example is that the hub uses information that's available through the Social Security Administration data to validate SSNs for the purpose of figuring out whether or not someone is a citizen, figuring out income for certain people, and in other factors. In fact, SSA really is a hub of a lot of information for the data for healthcare.gov. The hub will also try to use data that the IRS has in its data sources to also verify income, for example. It will also try to use the Department of Homeland Security's data to verify both citizenship for certain citizens and immigration status. So when the data and these sources can substantiate the information that applicants make when they're completing the application, it really is a great thing for the applicant. They can move on. They do not have to send in additional documents, which can sometimes delay things and can be tricky for consumers to figure out what exactly they must send in. So, you know, for a variety of reasons, this may not work out. And it's really important to note that when electronic data matching doesn't work, when those electronic data sources are not successful, it does not mean that the consumer is giving you the wrong information. There are a lot of reasons why this could occur. So for example, the data might not be available through the Data Services Hub to verify attestations for certain applicants. And that could include people who haven't filed taxes in past years. There's some limitations that we'll describe later on for certain citizens that weren't born within the US, but later on became US citizens. There might be people who are just new to the workforce and now are providing you know, new income data that it can't be verified through historical records. There's also times when the information that the consumer provides may not be reasonably compatible with an applicant's attestation about his or her current situation. And that can happen for a variety of reasons. People's situation fluctuates, their income fluctuates from year to year or week to week at times. So that can make it so it's difficult. You know, maybe somebody has a new job, maybe they worked less hours or more hours, maybe they have a new person in their family, or so their household changes. So for a variety of reasons, data matching does not always work. When there is a data matching issue, the eligibility determination notice will say that more information is needed to verify an eligibility factor, and the list of documents is provided that can be used to verify the eligibility factor. Most consumers can also enroll in a plan and receive subsidies during an inconsistency period. What we mean by inconsistency period, it's a time that's either 90 or 95 days long when a consumer has time to send in documents and healthcare.gov has time to review and process those documents. So you should note that I'm indicating that it's both, this time period is both for the consumer to provide the documents and healthcare.gov to do what it needs to do with those documents. So, you know, we don't want to wait till the 95th day to be able to turn in documents. That's the bottom line. So here we are showing what it looks like when a data matching issue occurs. So on screen on the application, the consumer is going to get something that it's going to pop up and let them know that this eligibility is temporary, and will flag for that consumer that more work needs to be done to satisfy the application process requirements. And their eligibility determination notice will also detail what the next steps should be. So if a DMI is not resolved in the allotted time period, the consumer will get an expiration notice. And if the DMI is resolved, the consumer will also get a notice indicating that it has been resolved. Before that, the good news is that the consumer will get a lot of other notices. They're going to get warning notices that will be sent at lots of different intervals in the mail. They will get emails, text message alerts, and at times they will also be getting telephone calls, letting them know that their DMI is potentially going to be expiring, and encouraging them to provide the needed information. So we're going to take a closer look at the verification of citizenship and immigration status. Healthcare.gov uses the Social Security numbers for a variety of reasons in the application process. And one of those is that for people who are actually applying to get coverage for themselves and they attest to being US citizens, that attestation of citizenship will be checked against records in the Social Security Administration. If citizenship can't be substantiated by the Social Security Administration, applicants are asked if they are naturalized or derived citizens. Those who answer yes to this question are asked to provide document numbers from their naturalization certificates or certificates of citizenship. And if these numbers are provided, the marketplace will try to electronically verify citizenship through the records that are held by the Department of Homeland Security's Systematic Alien Verification for Entitlements Program, which we also refer to as the SAVE program. And sometimes these electronic verifications are not successful, but that again does not mean that the applicant is not, an eligible immigrant. There's a lot of reasons for no matches. For example, sometimes SSNs are not provided, or there is, I said immigrant, I meant in this place citizen. So sometimes the electronic verification is not successful. It doesn't mean that the applicant is not a citizen. There are a lot of reasons for no matches. And again, for example, sometimes SSNs aren't provided, or there's a mistake made in providing that number, or sometimes an applicant has changed their name. Maybe they got married, or they used a shortened version of their name when they were completing the application, or for whatever reason, the SAVE or SSA database might have limited information and are not able to provide, a clear message back to healthcare.gov, yes, that they can verify the status. So there are some people who SSA just simply can't verify are citizens. And for example, they can't verify the citizenship for certain people who were born outside of the US, especially those who are like roughly my age. so roughly around 45 or older. So there are certain people who SSA just can't do that, and then others that they can. A lot of people they can verify or substantiate the citizenship. Some consumers who attest to being naturalized or derived citizens may not have the certificate numbers available to them. at the time of application. So they might not either one of those documents that are requested, they simply might not have it easily available to them. This is not something that people carry around with them. They might even have it someplace and wherever they're storing records, or maybe in some cases, they may have never gotten them, and they always use their US passport as a way to verify citizenship if they're ever asked. So when a person has a DMI, right? So there's a data matching issue because the electronic data sources weren't able to verify things electronically. Applicants are asked to provide proof of their citizenship to the marketplace, and the documents listed here, including US passports and certificates of naturalization, can prove US citizenship by themselves. But if applicants don't have one of these documents, they then have some other choices. They can provide one of these documents, but this is a little trickier because in this case, the applicant's going to have to provide more than one document. They're going to have to provide a document that proves citizenship, and those are listed on the left-hand side of this slide. And they'll also have to provide a document that proves identity, and those are listed on the right-hand side of this slide. So that together, those two documents would be able to satisfy the requirement. So now let's look at how the marketplace verifies that consumers have immigration statuses that are considered lawfully present under ACA rules. Applicants who say they are not citizens will then be asked to attest to having an eligible immigration status. They will then be asked to select a document type and to provide relevant numbers from those documents. Healthcare.gov then uses those numbers to match with information in the SAVE program, the same program that I talked about beforehand that is also used to verify citizenship of naturalized citizens. Sometimes the status can't be verified by this data match, but again, that does not mean that an applicant is not lawfully present. There are a lot of reasons for this type of no match. Similar to what we heard about for citizens, sometimes the names used in applications are not exactly as they appear in the records that SAVE assesses. Healthcare.gov will ask applicants if their name is as it appears on their document, and if it isn't, you should provide that the name as it appears on the document. Also, there are some immigration statuses that SAVE just simply can't verify instantly, and this can be for a variety of reasons, including for people who maybe recently came or recently either came to the U.S. and or were recently granted the current status that they have, their current immigration status. So applicants are asked to select a document type, and based on the type, will be asked to provide specific numbers from their immigration documents. We included a reference list here, so you know what information is provided what information will be asked of the consumer to be provided for each of the documents. And don't worry, I'm not going to read this to you, but these slides and they're just some slides that are going to be helpful for you to have as you're helping people, figure out what information they're going to have to provide in their application. So here's another, we'll continue down the list of different documents there. And I also wanted to note that we have a guide that looks at these documents and provides some helpful information and tips about where to find the numbers that are being requested on the application. So we provided a link here to that resource. And again, this is just a helpful tool to have, especially if you're, I was gonna say, especially if you help a lot of people who are immigrants, but actually it is also helpful if you rarely help people because, people, people who are helping people that are immigrants all the time, they might, begin to like know exactly where to look for the right number on one of these document types because they've seen it so often. Whereas if you don't see that many immigrants that you're helping, it's hard to remember all of those things. So we hope that this tool will be helpful to you. Okay, so if an applicant is unable to prove their citizenship or immigration status within the 95-day DMI window, their coverage will be terminated. Note that I said their coverage will be terminated. I'm not saying that their help to pay for the coverage will be terminated. It's different than what you're going to hear about later in an income DMI situation. In this case, the requirement to satisfy the citizenship and immigration status is tied to actual enrollment in a marketplace plan. If the person submits documents after coverage has been terminated, and then they're able to resolve the DMI with those documents, they will be eligible for a special enrollment period to re-enroll in coverage. That SEP, the special enrollment period, will begin the day that their DMI is resolved, and they will have 60 days from the date to re-enroll in coverage. They have some choices about when they can have that coverage be effective. They can either do it retroactively to the date of the termination. Of course, if that's the case, they would have to pay for any premiums for having that coverage activated retroactively, or they could do it prospectively after the plan selected. So they have that option. I'm going to go through a quick, well, it's not that quick, but I will try and be fast about it. In the interest of time, we have a scenario here where we're going to try and illustrate how a consumer might, or a family might experience all of this in healthcare.gov. So in this scenario, we have Roberto and Monica, and they're a married couple, and they have 2 children, Miguel and Elena. Monica was born in Germany and is a derived U.S. citizen. Her parents were U.S. citizens when she was born abroad in Germany. Roberto has been a lawful permanent resident for 7 years, and Miguel and Elena were born in the U.S. All family members provide their social security numbers on the application. Monica, Miguel, and Elena attest to being U.S. citizens. Monica is asked if she's a naturalized or derived citizen, and she answers yes. Monica does not have a certificate of citizenship, so she skips the question asking for those document numbers. Roberto attests to having an eligible immigration status, and he provides his immigration number, but not his card number. Let's see what happens in the data matching results. So the Social Security Administration was not able to substantiate Monica's attestation of citizenship because she was born outside of the U.S. She did not have document numbers to provide from a certificate of citizenship, so she was also not matched by the SAVE system. Roberto is not a citizen, so there's no citizenship matching that happens with SSA. And although he entered one number that he did have, he did not enter the other number that was requested. And we will say that in this case, SAVE was just was not enough information for SAVE to be able to match him instantly. So both of the children who were U.S. citizens, they were able to have their citizenship successfully data matched by SSA. So the eligibility determination notice will indicate the family is eligible to enroll in marketplace coverage with subsidies. And Monica and Roberto must send in information before the end of the 95-day period. So let's say that the family did submit documents, but still gets a warning notice from the marketplace. Monica sent in a consular report of birth abroad, but she also had to send in a document that appeared on that right side of that list that I showed you earlier that would prove identity, right? And she did not. Roberto sent in his foreign passport, which is a document that is listed as a document that he could send in, and at times would contain the information needed to prove his status. But in this case, we will say that his passport was not sufficient. So both Monica and Roberto are told that they must send in documents to prove status or their coverage will end. So now they're being requested to provide some additional documentation. Roberto will say was able to send in a copy of his permanent resident card, which that is sufficient to clear his data matching issue. But Monica does not have anything else to send. So she does not send in anything else. And Monica gets an inconsistency expiration notice that explains her coverage will end because she did not submit enough information to prove her citizenship. The sample notice here is from last year, and we assume that not much has changed, but we, of course, will be on the lookout, and we will share with you if we see anything new that happens. So what's next for Monica? Let's say that Monica wants to re-enroll in coverage with her family even after the coverage ends. She can clear up the inconsistency. And after resolving that inconsistency, she can get an SCP to re-enroll in coverage. So let's say that that April 30th, Monica's coverage is terminated because of the inconsistency. On May 3rd, Monica sends sends in her driver's license. She now has a driver's license, we'll say, and she sends it into the marketplace and she uploads it, which, by the way, uploading is a faster way than mailing in. So that's always a good thing if you have the ability to help somebody to upload their documentation. So she uploads her driver's license. So for submitted documents, now she has the combination needed, right? She had previously sent in something that proves her citizenship, and now she's sending in something that is proving her identity. So on May 14th, the inconsistency is now resolved. And at that point, Monica can choose to re-enroll with her coverage, which would follow the regular effective dates based on when Monica completes a plan selection. If Monica enrolls in coverage on May 14th, then starting June 1, she could select, she could also select, by the way, to have her coverage restored effective, May 1. But of course, if she did choose to do that, she would have to pay any past premiums as well. I think we're going to pause to see if there's any questions.
We do have one question. When a DMI for immigration status is resolved after the 95-day window and coverage has been terminated, does an individual need to file an appeal to make their coverage retroactive?
That is a great question. I do not believe that that is the case. However, I think it's something that we should probably follow back up with, because I think that the whole world of accessing retroactive coverage has been challenging in the past. And I'm not sure if they would make a person go through that type of route. It's not what's contemplated and how the rules are laid out, but what the rules say and then how things are processed are oftentimes different.
Those are all the questions we have for the moment. As a reminder, if you'd like to ask a question, you can ask the question by clicking on the icon at the bottom of your control panel. It says Q&A, and just type the question into the box.
Okay, this is Tara, and we're just going to run through some slides on the verification of household income. The process is very similar to what Shelby outlined, but some of the rules are a little different. So as you know, applicants attest their projected income on the healthcare.gov application. So you have to submit for every person in the household what is their source of income, and what is the amount of income. And you can see on the screenshot what this looks like now. This has changed over the years. But they list all the types of income that are most common, and then some less common ones. And then there's an other category for the very, very rare kinds of income. But you can see how specific the question gets about the type of income. And that's because attestations on the application are matched with data in the federal hub, as Shelby said. So it's important to know and to be very specific about the kind of income you have and the amount of it. There are a lot of reasons that the data matching process might not verify the income that you attest to on your application. So there could be a change in your job, a change in the number of hours you work, a change in the household. So maybe you have an older child who is going to be filing their own tax return and is no longer considered to be in the household. You have sometimes people retire and they'll lose wages, but then they'll gain other kinds of income. Someone might be self-employed and have variable income, or people might have one-time income such as an IRA withdrawal or a death benefit. And even though those are one-time, unexpected sometimes, and sometimes very consequential income, that remember that they're still counted toward the household income. So so that's a difficult one for people to wrap their heads around when they're applying for coverage, because for instance, in the case of an IRA withdrawal, people think of it as their money anyway. And so why does it get on the application? And it gets on the application because it will be taxable income when they complete their tax return. So it's important, and that's why the list of income sources is really important, because it can give you ideas of what to talk to a client about. So if you're helping someone work through the application, my recommendation is that you actually talk through the entire list, because undoubtedly someone is going to say, oh yeah, when you get to the 14th type of income that they wouldn't have thought of had you not gone through the list. Also, the data matching may not verify the attested income if there's no tax data available because you haven't filed in prior years. So again, think about someone who was in a household of their parents, and then now they're filing taxes on their own. They haven't been a tax filer before, so that help won't have income. The threshold for triggering a DMI is when the attestation is different from the data hub by more than 25% and at least $6,000. And so the attestation is going to be accepted if the attestation is higher than the income in the data hub, regardless of the income difference, or the attestation is lower but doesn't trigger the threshold. So what does that mean? That means that you can project income that's higher than your previous income, and the marketplace generally isn't going to challenge that, with one exception we'll talk about in a minute. Why is that? It's because people who are attesting to higher income would get a lower premium tax credit. Think of this as, a fraud protection, basically. People would be getting a lower premium tax credit if they have a higher income. And so the marketplace is going to assume that must be right. Whereas if you project your income to be much lower than you've had in the past, then this rule protects the marketplace and protects Treasury from paying out too much in APTC to someone who is going to later reconcile at a higher income level. A DMI is triggered if there is no information in the data hub, or the attestation is 25% and $6,000 lower than the data available in the hub. Or I said that there was one exception. The attestation is above the poverty line, but data sources suggest income is below the poverty line. And the same threshold applies there. If any of these are the case, then the applicants will still be awarded subsidies based on the income attestation on the application, but they have to provide documents to verify their household income. So a little bit more about this relatively new exception that this came into play in 2019 and will continue going forward. This is particularly relevant for people who are in states that have not expanded Medicaid. because essentially this is trying to identify people who may be in the coverage gap with income below 100% of the federal poverty line and not eligible for Medicaid or for premium tax credits, but who are attesting to income that is above that amount. So they are attesting to income that would earn them premium tax credits. So this is applying that threshold in those cases too, and saying that if your income is 25% higher than the data hub, or and more than $6,000 higher, then you will be subject to a DMI. And of course, this doesn't apply to non-citizens who are lawfully present and ineligible for Medicaid due to immigration status, because they're eligible for premium tax credit below 100%. So those applications should not be flagged. Here's an example of how this works in practice. We have Walt, who lives in Missouri, which is a state that did not expand Medicaid. Since 2018, he's worked part-time as a bookkeeper. His annual earnings are just below the poverty line. So in Missouri, he's not eligible for Medicaid, but he's also not eligible for a premium tax credit. But let's say that for 2020, he's getting a raise and he's going to work some more hours. And so his income is going to be higher. He's going to be in the territory for premium tax credits. So his projected income exceeds his prior income by more than 25%, but there is less than a $6,000 difference. And therefore, no DMI is triggered. So he's not going to have to submit any additional documentation of his income. His attestation will be accepted. But let's say that his earnings in 2018, which is the last information that the Data Hub will have tax data on, let's say his earnings in 2018 were actually lower. And based on that, his projected income is going to exceed his prior income by more than 25%, and by $6,000. In this case, he's going to have an income DMI. So he's going to need to submit additional documentation that proves his income. What kind of information could Walt submit? Well, the marketplace has a lot of documentation and a lot of assistance in the kinds of acceptable proof that they'll take. So you can, if the application includes wages, here are some ideas. You can submit a 1040 tax return or recent W-2. Those won't work for Walt because his prior is 2019. Even if he rushes to do his 2019 tax return, it's not going to have the right income on it because his changes start in 2020. So those are out. He can submit a recent pay stub. He could submit a letter from his employer. Those would be both possible if we're in 2020. A copy of a check paid to you as wages, signed timesheets. And you can see for every other kind of income, there are suggestions about the kinds of documentation you could submit that would be adequate to prove your attestation. And the marketplace has additional resources, including this chart, which really helps someone spell out, who is the applicant or who is the name of the household member, what kind of income do they have, how are you verifying it, what is the income they're attesting to, and what is their annual total. So this is really helpful. And they also have this broken down for in a self-employment specific chart that can help people work through the amount of income they expect and the expenses they expect to have. And those are available. If you routinely help people through this, I think that these are good resources to look at, and we have the link there. So let's get back to Walt. Walt's projected income triggers a DMI. So what can he do? Walt is going to, he's going to still enroll in coverage with APTC and CSRs, and he's going to get a notice that he needs to submit documents to prove his income within 90 days. So Walt is going to submit a couple of things because it's better to submit a little more than too little. So he's going to submit a letter from his employer that documents the increase in wages and hours. He could also submit a pay stub or a check paid to him as wages to show the pay increase and his increased hours once he gets the raise. So part of this for Walt might depend on the timing. So if he wants to get this DMI taken care of in December and he doesn't yet have a pay stub that's going to show the correct number of hours and the correct wage, then he can get that letter from his employer. If we've already ticked over the calendar to 2020 and he has a pay stub and we're still within that 90 days, then the pay stub might be good enough to show what his new income will be. So in January, he submits a pay stub and his DMI is resolved in February, and his coverage and his financial assistance will continue without interruption. But sometimes documents aren't available. And in that case, you can basically make your own document by creating a signed statement that gives all the relevant information. So you'll want to include the application ID, the state, your contact information, your projected annual income. Assume that they have nothing. Provide everything on your form, on the letter that you submit, and explain what your income projection is. So in this case, this is someone who's starting school in the fall. They're quitting their job. They have the year mapped out, and here Marketplace is how I got the math. So let's look at an example of that. Jalen is self-employed and Maya works part-time at a bookstore. Jalen's self-employed income was $50,000 on their 2018 tax return. Maya had $25,000 of income from her job, and so their total was a household income of $75,000. But Jalen lost his best customer, and so he expects that he'll only have self-employment income of $25,000 for 2020 after his deductions. Because of the loss of income, they also expect that they'll need to withdraw a little bit of money from a retirement account. So when applying for 2020 coverage, they project annual income of $55,000. So that's $25,000 from Jalen's self-employment, $25,000 from Maya, $5,000 from their retirement account. This is more than 25% and $6,000 below what their 2018 tax return shows, and so it triggers a DMI. They're going to get 90 days to submit documentation of their income. And if they fail to submit documentation, the Marketplace is going to use their 2018 tax return information as the basis for determining their premium tax credit. So that higher income, meaning they would get a lower premium tax credit, is what would be used if they do nothing. So what are some of the things that the family can submit? Well, the Marketplace would recommend creating what they call a self-employment ledger, which is basically showing dollars in and dollars out. The income that someone expects to receive plus the expenses that they'll be able to deduct. This can be difficult for some people to guesstimate, especially if income is inconsistent. But this is the best that we can do on a prospective basis. They can also submit a statement that explains that he lost a client and he doesn't expect to replace the lost income with new business. And they can explain that they'll take money out of a retirement account. But don't forget to include Maya's most recent pay stub or some other documentation of Maya's income. Because remember, when you are verifying and clearing the DMI, if you're verifying income, you need to verify all the income and not just the one that you think has a question mark over it. Going into this, if you're talking to this family, going into this that it's Jalen's income that is the question mark here, right? Because his income has changed a lot. But just explaining Jalen's income doesn't explain that the household's income. And so you need to look at all the sources of income and justify all of them. If DMIs are not resolved, two things can happen. So if income information is available in the Data Hub, then the APTC is going to be changed, is going to be based on the information that's in the Data Hub. So like we said, for that last example, even though Jalen's family was projecting their household income at $55,000, if they did nothing and didn't clear the DMI, they would be, their APTC would be based on a family with household income of $75,000. Now, if there's no income available in the Data Hub, then subsidies will be terminated. When subsidies are reduced or terminated, remember the enrollee is still responsible for the higher share of the premium or for the entire premium. That means if you had said before that the money could be withdrawn from your bank account, the premium could be withdrawn, then that automatic payment will continue at the higher premium level. If you don't pay the full premium, like you can't pay the full premium, then you're going to begin a grace period One practice point is if someone cannot pay the full premium, they should consider ending the plan rather than letting the grace period kick in to avoid owing the first month's premium. But letting the grace period extend, of course, gives them a time to resolve the data matching issue. So think carefully about how you proceed when someone has let their data matching issue expire, and what your best options are to minimize their payment, but to maximize coverage. Enrollees can restore their APTC by resolving the DMI. They can do this by submitting documentation, or if that hasn't worked, they can file an appeal. If the appeal is successful, then the enrollee can get retroactive APTC. And I know we had some questions earlier about appeals, so that's why we held off on those. And if a person doesn't appeal, or if the appeal is unsuccessful, then the APTC for the gap months might still be available on the tax return. But you have to make sure the person was enrolled in a marketplace plan and paying the premium for those months. So, you can still, remember we've said in the past that there are two ways that you can get your PTC. You can get it in advance, or you can get it on the tax return. Well, if someone has stayed enrolled in their coverage, this is a case where they could get it on their tax return later. So one more example, I think. John has never filed taxes. He's a newbie, and he's tested annual projected income of $22,000 for 2020, but there's no hub information because he's never filed taxes. And for whatever reason, dubious or not, he did not get the frequent reminders from the marketplace that he needed to submit documentation. And so he comes to you after his subsidies have already been terminated. John has some options. John can submit documents now. So if he verifies his income, he can restore his subsidy for the future months. But remember, he has to be enrolled, so he's not eligible for an SEP on this basis. He can appeal. If his appeal is successful, he can get retroactive APTC, or he can just get it going forward. But under any scenario, if it's possible, he should pay his premium and maintain coverage. So if John stays in his plan and he pays the premium, he can claim the PTC on his tax return. For the months in which he's eligible, he can get potentially that retroactive APTC. He has more options if he has remained in coverage. But if he just fails to pay the premium and he lets the coverage lapse, then he's not eligible for a special enrollment period on this basis, and he might need to wait until the next open enrollment period. So we focused a lot on income verification and citizenship immigration status verification, but there also is verification of other minimum essential coverage. And we'll spend just a minute on this and then get back to your questions. The Marketplace Hub also electronically matches with Medicaid agencies, Medicare, the Office of Personnel Management, and databases of employer-sponsored coverage to show whether the applicant is enrolled in or eligible for other minimum essential coverage, MEC. In that case, they have to prove that they're not eligible and or enrolled in MEC. So just like with other, just like with the income DMI, a person can enroll in coverage with APTC based on their attestation, but then they need to submit this documentation to prove that they are not enrolled in other coverage. So the kind of documentation that you're looking for is like a letter from an insurer that shows that coverage was terminated, a notice from Medicaid, from a Medicaid or CHIP agency, or other proof from a source of coverage. And if it's not resolved in 90 days, as with the income DMI, someone loses eligibility for APTC. Now, this is challenging to a lot of people because it can be difficult to show what you don't have. And so some people get caught up in a little trap here, because if the data is showing that you have Medicaid and you do not have Medicaid, then you would need to potentially get a statement from Medicaid that says you do not have Medicaid. And can be a really clumsy process. But just know that this is a thing, verifying for other minimum essential coverage. We also want to mention, though, this other process. So all of these things that we've been talking about are things that happen at the application time. But also during the year, there can be other data matching. This is called periodic data matching, where the marketplace periodically checks enrollment in Medicaid, CHIP, and Medicare. If a person is found to be enrolled in public coverage and coverage with APTC, they're going to receive a PDM, periodic data matching notice, and they have 30 days, not 90 days. They have 30 days to respond. A Medicaid CHIP PDM notice will ask the enrollee to end their marketplace coverage if they're enrolled in Medicaid or CHIP, or to update their market map application if they aren't enrolled in Medicaid or CHIP. And if the consumer doesn't do anything, APTC will be terminated, but the plan will stay in effect at full cost. So it's important that people, for people to read the notices that they get through the year. This, like many of the notices, it's lengthy, it can be confusing, but this is an important consequence that the plan stays in effect at full cost. People will lose their, potentially their ability to pay for the plan. A Medicare PDM notice will either terminate APTC, but leave the marketplace coverage in effect again at full cost, or it will terminate both the QHP and the financial assistance if the person elected to do so on their application. So there's a question now on the application about what will happen if you are determined to be Medicare eligible, or if you're eligible to enroll in Medicare. And most people say that they would like to have their QHP terminated in that case. Now, if the QHP is terminated, other members of the individual's family also get terminated, but they get an SEP so they can re-enroll in coverage. So again, this is a place where people will need to read the notice very carefully. I think that the little bit about the SEP and needing to re-enroll in coverage, the notice I saw, it was at the bottom of page 2. So it's not necessarily obvious to folks that they'll need to take action to continue in their coverage. So that's why these notices are so important.
So now I'm going to try and do it very quickly about identity proofing, which is not data matching, even though we put it onto this webinar, because oftentimes people get very confused between what's happening with somebody. What is this identity proofing? Is this, a DMI that we're trying to resolve? It can get quite tricky for people. So identity proofing is used to make sure that the marketplace account is secure, and that the person completing the application is who he or she says they are. It's not an eligibility requirement, but if the person can't be identity proofed, they won't have full access to the online account. They won't be able to submit their application online. They won't be able to select the plan online. They won't be able to report changes online. The first attempt at identity proofing on healthcare.gov will provide a consumer a bunch of questions based on information available through credit history. And not everybody has credit history, so not enough questions will be able to be generated for such people. And if no questions or not enough questions are able to be generated for the people, that person might they might not even get questions, and they might be told immediately to call a telephone number. That telephone number is linked to Experian, which is a credit history agency. And then over the telephone, they in some cases, the individual might be asked some questions to see if their identity can be proved that way. Or some individuals will immediately just be told, hey, submit one of these documents. And then we can, if the person is able to submit the documents online on healthcare.gov, then that might be able to resolve the identity proofing issue. So basically, there's kind of 3 ways. You can do it online if you have enough questions and you know the right answers, and guess what? Credit history is not infallible. Sometimes there are mistakes in credit history. So sometimes there are enough questions, but you don't have the right answers because they might not be right. Or maybe you just don't remember what color your car was in 1985. So other times, so sometimes you can do this over the telephone. Oftentimes you have to submit documents to overcome this hurdle. It's important, really, really important for you to know that when this occurs, people do not have to delay submitting their application. They can still go to healthcare.gov's call center, the marketplace call center that we often refer to it as, and they can submit their application over the telephone and the marketplace. If the person is asked to submit documents, guess what? The list of documents is going to look super similar to the identity documents that we talked about earlier for people who have to prove their citizenship. So there's a whole bunch of different documents that people can use to prove their identity. And such is the case that then people get super confused and they don't realize, you know, when they're being asked to submit documents for the purpose of identity proofing and when they're being asked to submit documents for the purpose of citizenship or immigration status. And then people get super upset. And then they call me and they say, why, Shelby? Is this person, I thought we were supposed to, you know, like once proven citizenship forevermore. Well, this might be the reason why they're being asked to provide some additional information. So again, like I mentioned beforehand, for people who, you know, you want to just move and do not want to delay, you may never see this person again, right? That came into your office. If that's the case and you want to go ahead and proceed with the application, you are able to use the See Plans and Prices tool to help kind of narrow down the enrollment options, because the last thing you want to do is to get on healthcare.gov's marketplace call center and, you know, get a listing of all the different plan options over the telephone by an operator. So when you have to submit an application, select the plan over the telephone, definitely a good strategy is to see plans and prices, you know, to be able to browse those plans so you begin to narrow things down. You might not have the numbers perfect in what you're able to narrow down using this. The call center operator will have, you know, the right information that is consistent with the income information that you provide and other data factors that you provide on the application. So you can complete the application on the telephone. You could also do it on paper, but I don't know if anybody ever does that. That's a real slow process. You can select the plans over the telephone. You can request paper notices. I really recommend that you do that because if you don't have a working account, you're not going to be able, you might also experience some problems getting notices from that account. And then you can report changes and complete renewals to the call center as well. So for people who can't make it through, that there's another opportunity. We have some tips to prevent DMIs, and in the interest of time, I'm not going to even run through all of these. Some of them that we've already talked about as we were going along in the presentation, you know, things like making sure that the name is as it appears on the document, whatever document that you're looking at, right? So if you're looking at a social security number and the name says Jane Smith, but then you're looking at the application and it says Jane Gonzales, you might say, oh, wait a minute, we need to provide the other name. We need to use the function to show that there's a difference in the name. So there's tips here, and then we have some tips on how to resolve DMIs, including some tips that are more technical about how to structure the file and the file name in order to upload it successfully onto healthcare.gov. We also have some additional resources here that healthcare.gov points to, some sample notices as well, our reference guide that we talked about earlier, and here's our list of upcoming webinars, and turn it back over to Ina.
Thank you, Shelby. Thank you, Tara. We do have a couple more questions. So if someone fails to resolve their DMI, will they have to pay back their 3 months of APTCs when they do their next year's tax return?
Well, it depends. So let's say that it's an income DMI and I don't resolve it, and so they cut off my APTC eventually, and it depends on depends on a lot of things. So if I was actually eligible to be getting the APTC at the time, even though I didn't prove it at the time, I didn't take the steps I needed to do, but I was eligible anyway, and I paid the premium to stay enrolled, then you wouldn't need to pay back the APTC. But if you stopped paying your premium and the APTC was still going to the carrier, then you would need to pay back at least 1 month's APTC. So it has to do with how the grace period rules work.
Great. Thank you, Tara. We have one more question. It's a little lengthy. So are the attestations regarding income checked on a per individual basis or based on the total household income? For example, if a married couple reports that one of the two is likely to make $30,000 in a year and the other is likely to make $0, but in the most recent data available via the hub, they each made $15,000, is this likely to trigger DMI?
Well, I think that, you should think about the kinds of information that might be available in the hub. So they have information on household income, but they probably also have W-2 information. And so I would not rely on the fact that, oh, it just all works out in the end. I would still want to prove person by person, income source by income source, what their information, what the correct information is to support the attestation.
Great. Well, thank you so much. And as a reminder, we'll be distributing the materials from today's session via email, and we'll post everything to the Beyond the Basics website at www.healthreformbeyondthebasics.org. The next part of this webinar series covering plan design is scheduled for next Tuesday, October 15th at 2 p.m. Eastern, 11 a.m. Pacific. You can register for upcoming webinars on the Beyond the Basics website under upcoming webinars. You can also find additional resources on the website, including reference charts, guides, and frequently asked questions. If you have questions or need assistance, please email our Beyond the Basics contact email at beyondthebasics@cbpp.org.